Hello, my name's Michael. I'm a psychiatric nurse practitioner student, and I'm going to be interviewing you today.
Hi, I'm Kayla. It's nice to meet you.
Hi, Kayla. It's nice to meet you as well. So, Kayla, tell me, what brings you in today?
I've just been feeling pretty exhausted and depressed and down lately. Not really feeling like myself.
I see. When did this start for you?
About 6 months ago, after I got a divorce.
And over the past 6 months, has anything made it better?
No.
Has anything made it worse?
Just time. It's gotten a little worse.
Okay. And 6 months ago, did you seek any treatment?
No, I thought I'd be okay on my own.
Okay. So what brings you in now?
It's starting to affect my work. I've had to miss some days, and the kids and my coworkers have just said some things, so I figured it's probably a good time to get some help.
I see. Well, I'm glad you're here today.
Thanks.
So, Kayla, I'd like to ask you some more questions about some of the symptoms you may be having.
Okay.
How has your sleep been?
Pretty bad. I usually sleep 8 or 9 hours a night, but lately it's maybe been 5 or 6.
Okay. Are you finding it difficult to fall asleep at night?
Yeah.
Okay. Is anything keeping you up at night?
I just lay there awake. Sometimes there's thoughts and stuff that just go around in my head.
I see. And once you fall asleep, are you finding that you're waking up?
Yes, I wake up a little earlier than normal. Yeah, it's hard to stay asleep.
I see. How have your energy levels been?
Very low. It's really hard to do things and have the energy for it. Just tasks around the house and chores, grocery, meal stuff.
And are you feeling, how's your motivation to do things?
Pretty low too. Yeah, it's hard to find the motivation, will, desire to do all that.
I see. How's your appetite been?
Decreased. Yeah, I used to eat regular meals, some snacks with that, but now I probably have one meal a day, maybe a snack or so.
Okay. Is there a reason you stopped eating?
I just don't feel as hungry. Yeah.
Okay.
So then I forget to eat because I'm not hungry.
Okay. Have you been losing weight?
A little bit because I've not been eating as much.
Okay. Do you know how much you've lost?
Not really. I just noticed a little difference in my clothes. Yeah, I don't really weigh myself very often.
Okay. How has your ability to concentrate on things been?
Also decreased. I used to read for hours, but now I can maybe sit for 10 minutes and focus on my book.
I see. And you said you read books. Are there other things you enjoy doing?
With the few friends that I have, I like to hang out with them, get together. Yeah.
And how has that been recently?
It's just not as fun. I don't find as much joy in any of it.
Okay. Sometimes when people feel depressed and low, they have feelings of worthlessness. Do you have any of those feelings?
Yeah, I think so. It's since the divorce and everything, and now that all this is affecting my work, I definitely feel worthless and hopeless sometimes.
Also, sometimes when people feel that way, they get thoughts about a way out, and sometimes they think about killing themselves. Do you ever get any of those thoughts?
Not really. Maybe once or so, it just popped in my head and then was gone. A quick kind of thing.
Okay. And when it popped in your head, when did this happen?
That was a couple months ago, I'd say. Yeah, 3 or so months ago.
What was going on 3 months ago when this popped in your head?
It was just all of the depression, like all of it getting worse. I just was laying in bed, and then I was just thinking about it, I guess. It was just like, you know, in movies they'll like take pills and have some drinks or something, and so that's just kind of like what went through my head. And
Okay.
yeah.
Okay. Did you, when you were laying in bed thinking about the pills and the alcohol you said, or drink something, did you have a pill in mind that you were thinking of taking?
No.
Okay.
Mm-mm.
Do you have any pills at home?
Mm-mm.
Okay. Did you go out and try to find pills or anything?
No.
Okay. And on the drinking side, what were you thinking about drinking?
Just like alcohol. Yeah.
Okay.
Nothing specific. Just, yeah.
Do you have any alcohol in the home?
No, I don't really drink very often. Just like occasionally, socially.
Okay. And when you say occasionally, socially, how many times a week are you drinking?
No, not even weekly. Yeah, like maybe once a month
Okay.
max.
Okay. Okay. And now, since that last time you had those thoughts about the pills and the alcohol, have you had any thoughts of harming yourself since?
Mm-mm.
Okay. In the past, have you ever harmed yourself with, say, cut yourself or harmed yourself in any way?
Mm-mm.
Do you have any guns in the home?
No.
Okay. Okay. Well, thank you so far, Kayla. I know these things can sometimes be a little bit challenging to talk with someone about, especially someone you're meeting for the first time. So I appreciate your openness with me. I'd like to ask you some more questions just to get a better idea, to get to know you a little bit better, okay?
Mm-hmm.
Would you consider yourself to be a worrier?
I didn't used to be, but maybe a little bit now. I worry a little more.
Okay.
Mm-hmm.
And when did this start for you, this worrying?
In the last 6 months. Yeah.
Okay.
Yeah, so.
Okay. And how often are you finding yourself worrying?
Not super often, but a little bit. Yeah.
Okay. Is there anything specific you're worrying about?
Just like how work's going and what people think, and how this is kind of affecting everything.
Okay, I see.
If I'm ever gonna be with anyone again.
Mm.
Yeah.
Some deep thoughts you've been having.
Mm-hmm.
Do you ever, sometimes when people worry, they can have this intense worry of this shortness of breath, or they feel like their heart is beating real fast, they get real anxious. Have you ever had that happen before?
No.
Okay. Some other things that people may worry about, sometimes they get these thoughts that pop in their head that make them feel like they need to do something to relieve that thought, like wash their hands a lot. You ever get any of those kind of thoughts?
No.
Sometimes it may be checking things before they leave the apartment or their home multiple times.
No.
Okay. Have you ever had, sometimes when people have traumatic events in their life, they may have thoughts about those events. Have you ever had a traumatic event happen?
Yeah, I guess so. One time I had a pilonidal cyst, and I had it removed, and then I went into septic shock.
Oh, wow. That sounds like a scary situation.
Yeah, it was.
How are you doing now from that?
Good. Yeah.
Good.
Grateful to be here.
Good. That's good. And have you noticed any distressing thoughts about that?
No.
Okay. Any nightmares that you've had related to that incident?
Mm-mm.
Okay. Anything else that comes to mind that you have maybe nightmares about or recurrent thoughts about?
Mm-mm.
Okay. Sometimes when people feel low, they also sometimes may feel extra energized at times? Have you ever had a time where you felt like you had so much energy you didn't need to sleep?
No.
Or where you felt extra irritated and upset about things? Any time in your life where people said that you weren't like yourself, that maybe you were talking a lot or going out and buying things and doing things you normally wouldn't do?
No.
Okay. Have you ever had an experience where it felt like your mind was maybe playing a trick on you? You're hearing or seeing things that other people weren't hearing or seeing?
No.
Do you ever feel like something is somebody's trying to control your body or make you do things? Do you feel like people are out to get you?
No.
Okay. I'd like to ask you some questions just about some of your history. Okay. We touched on alcohol. You said that you drink occasionally, maybe once or twice a month. Do you do any other? Do you take any other drugs? Not for medical purposes?
No.
Okay. Have you ever done any illicit substances in the past? Marijuana, cocaine? Okay. Do you, now family history wise, do you have any past family psychiatric mental health history?
No. That I know of.
Do you yourself have any past, have you ever been diagnosed with a psychiatric condition or anything like that?
No. This is the first thing that's really been an issue for me.
Okay. Are you taking any medications for the issue that you're having right now?
No.
Any home remedies that you're doing?
No, I figured I'd wait for the professional.
Okay, well, we'll see what we can get figured out for you today, okay? Have you ever been admitted to the hospital for a psychiatric reason at all?
No.
Okay. Medical wise, do you have any medical illnesses?
No.
Are you taking any medications for any medical purposes? Okay. Do you have a primary care doctor?
Yeah.
Okay, when was the last time you saw your primary care doctor?
It's been a while, probably a couple of years.
Okay.
Yeah.
Do you have any allergies to medications?
No, just seasonal stuff.
Okay. Have you had any surgeries?
No.
Okay. Any other medical issues going on?
No.
Okay. I'd like to ask you about a little bit more about your life, just to get to know you a little bit better, okay? Tell me more about your work.
So I work as an elementary school teacher. I've been doing it for 15-ish years now. Something I've always really enjoyed, and it's just been hard to feel that lately.
Yeah, I bet it. Yeah, well, I'm glad you're here again.
Yeah.
How has are you living with anyone right now?
No, I'm by myself now. I moved into an apartment, so I'm there by myself.
Okay. Any difficulty paying your rent or your mortgage?
No, money's a little more tight, but I'm making it work.
Okay. Now, to be an elementary school teacher, what type of education do you have?
I got my bachelor degree and then went on and got my master's as well.
Oh, very nice. That's awesome.
Yeah, thanks.
Yeah. Do you, I know we mentioned earlier that you enjoy reading and spending some time with friends. Do you have any other hobbies?
I like to paint and draw a little bit, be outside, and I love horses too.
Oh, horses are really neat.
They're the best.
They're majestic creatures.
Yeah.
Very nice. A little bit of a different question. Do you have any legal issues right now going on? How about in the past?
Just the like divorce stuff
Okay.
and figuring all of that out.
Okay, I
But
see.
that's all.
I see. We've covered a lot of information so far. Is there anything that you feel like you'd like to add that we may have missed that you feel like is
I don't think so. I think that covers it all
okay?
that I can think of.
Okay, Kayla. Well, I'd like to tell you my thoughts on the diagnosis that I believe that you meet the criteria for today. Okay. I believe you meet the criteria for major depressive disorder. This is based off the symptoms that you've told me of your sleep and your appetite, of feeling depressed and low for the last, what sounds like 6 months.
Yeah.
So, and all the other symptoms we talked about, the concentration, the lack of interest in the things that you used to enjoy, the appetite changes. Based off of this information and the form that we had you fill out, that patient health questionnaire, it does seem like you have a moderate to severe case of major depressive disorder.
Okay.
So that's what I'm going to diagnose you with today, is major depressive disorder. Do you have any questions about that?
I don't think so.
Okay. There could many their cause of the cause of it. It seems to be related to some of your life changes. However, it can be caused by medical issues as well. So to help rule out some of those medical issues that could be undiagnosed or not yet known, I'll do some labs for you.
Okay.
And I recommend you following up with your primary care doctor.
Okay.
The labs I'm going to order for you is a complete blood count and a basic metabolic panel. This is kind of going to overarchingly look at your body and tell us if there's anything specific that we may need to investigate farther. I'm also going to order a thyroid stimulating hormone lab, and this looks at your thyroid gland in your neck. Sometimes if people have a little bit of an underactive thyroid, they can have some symptoms of feeling low and some of the other depressed symptoms. So I want to look at that to make sure that that's not contributing to this at all.
Okay.
I also want to check your vitamin D levels. Being that we're in Ohio, the northeastern part, we don't get much sun always, so we commonly do see a lot of vitamin D deficiency. Vitamin D deficiency can also cause some of those some symptoms as well. I am fairly confident that you don't have, it doesn't seem like you have another psychiatric condition based on the questions we've discussed today. So we'll move forward with the major depressive disorder.
Okay.
Treatment-wise, I would like to start you on a medication called sertraline. This medication will help to hopefully decrease your depressive symptoms. Ideally, I'd like to see total remission and doing away of your symptoms. But we won't get ahead of ourselves. That'll be our goal. We'll try our best to get there, okay?
Okay.
Sertraline is a drug that should help improve your mood as well. We'll start you on 50 milligrams. It'll be one time daily, taken in the morning. Sometimes the medication can cause some side effects. Some of the more common side effects include a decreased sexual drive, stomach discomfort. You could have nausea, diarrhea, and constipation even. Also, want to look out for any bruising or bleeding. Sometimes you can bruise or bleed a little bit easier on the medication.
Okay.
Some more serious side effects, if you find that you feel really irritated and upset and have all this energy all of a sudden, let me know. and we can do something about that, and we'll change up your medication, okay?
Okay.
Also, if you, some more serious side effects again could be seizures or things, seizures and stuff like that, so we'll keep an lookout for that. The lesser side effects that are a little bit more common, like the stomach issues and the decreased sex drive, if those become an issue, usually at the beginning of therapy, we'll want to wait because those can kind of go away hopefully after a little bit. And if you're not tolerating the medication, we can always see what we can switch to or decrease your dose, okay? But 50 milligrams is that good starting point. The other thing I'd like to do for you is start you in some therapy. Research shows that medication and therapy helps to treat your depression best. So I'm going to set you up with a cognitive behavioral therapist. You can try that out 2 times a week, and I'll refer you to somebody for that, okay? So I know we went over a lot. Do you have any questions right now for me, Kayla?
Will you have all that written out for me?
Yes, I will send you home with an after visit summary that will outline everything we've discussed, give you some information more on major depressive disorder, how common it is. Actually, about 1 in 5 to 1 in 6 individuals in their lifetime experience major depressive disorder. So there are a lot of people who are affected by it. So I'll have the nurse also go over some more of the information with you to kind of reiterate some of the things that we discussed, okay, before you head out. Do you have any other questions?
No, I think that sounds like a good plan, and I look forward to doing all that.
Very good. I do want to mention you did fill out that patient questionnaire form. We're going to check that every couple weeks. It'll kind of be our little gauge to see if how you're doing. If that number is going down, that's a good indicator, hopefully, that you're feeling better and getting better, okay? So we'll do all those things, and I want to see you back here in a couple weeks just to make sure that your medication, feeling okay, and to answer any more of your questions and to do a little touch base. And we'll compare your questionnaire from now, and we'll see. I don't suspect too big of a change, as the medication can take a few weeks to sit in, about 4 to 6 weeks. But you may see some better mood pretty early on, hopefully, some increased energy, I hope. Okay, so let me know if you have any symptoms. One other thing I'd like to mention is important. Sometimes these medications can cause increased suicidal thoughts. It's not as likely in individuals over 24, and I know you're 32, right? So if you do have any of those increased suicidal thoughts, let me know immediately, okay? Any last closing questions, Kayla?
I don't think so.
Okay.
Thank you.
Well, thank you so much for coming in, and I look forward to working with you more.